what is going on with PMS? Is it normal to have some pain? And when is it not normal?
Well, there can be some like diverse things going on here. So if we talk about straight, we'll say classic PMS. So that is actually a condition that occurs prior, just as in the name, premenstrual syndrome. So that would be symptoms primarily, but not exclusively, emotional. And that would be like anxiety, depression, agitation, along with breast tenderness, sometimes like sleep disturbances that occur in the week or two, even, but usually closer to a week before the period bleeding begins, and then can go into the first couple of days, but usually subsides with the period. But then there's the pain that you discussed, which is perhaps a different but maybe interrelated issue, where the pain can begin, the menstrual cramping can begin prior to the onset of bleeding and then continue for days into the bleeding, and depending on how many days the actual bleeding lasts. And of course, someone could have both. I mean, there's nothing that says you can't have multiple things to deal with. And there really has not been anywhere near the research, as is always the case
Right.
with male specific, we'll say female specific problems. So one of the things that you always have to consider, we'll start with the pain part first, the menstrual cramping. So one of the things you always have to consider would be something physical, anatomical, as opposed to functional. So when we talk about functional pain, the most classic one would be like irritable bowel syndrome, where you can do colonoscopy after colonoscopy, you could do imaging tests, you will never see anything because the problem isn't with the structure or the anatomy, it's with the function. So functional pain, functional problems are super real. They're not like, oh, it's all imagined, you're a hypochondriac or something like that. The object that's creating the pain is really malfunctioning. So like with irritable bowel syndrome, I mentioned that because these are often interconnected
Yeah.
problems. Yeah, people have both. Um, is that you're getting like excessive amounts of cramping and dysfunction of the motility of the gut. So you could think of that with menstrual cramping pain that you in a functional, we'll say dysmenorrhea, painful period situation, you could do imaging, you could do tests, looking at structures and so on. You'll never see anything because it's related to the function of the uterus, which is a muscle. If you think about the bowel, it has muscle in it. That's what creates the motility. And if you think about the uterus, it's a giant muscle ball, right? It's like, so what are the parts of a uterus? There's the lining, which is called the endometrium, and there's the myometrium, which is the bulk of what a uterus is, and that's the muscle. And then there's the serosa. There's sort of like silky covering that covers like all the organs inside the body. Now, when you have dysfunction of the muscle contractions, then you're going to end up with pain, whether it's the bowel or whether it's the uterus. But first, before we get into, well, the function part, you do have to rule out structural things or other things that are not just related to the function of the uterus. So, what could they be? Well, one condition is endometriosis. So, and that could even be present in young teens. We never thought it was in the past, but now we know it actually can be. And that's a condition which is about 10% of the reproductive age women. It's not rare. And it's one of the major causes of infertility and pain with periods, and sometimes pain even without periods. And it is where the uterine lining cells, called the endometrium, grow in other places in the pelvis. And every single woman has what's called, with their period, retrograde menstruation, where tissue and blood inside the uterine cavity goes out the fallopian tubes into the pelvis. And the immune system is supposed to be designed perfectly to deal with that problem by not creating explosive amounts of inflammation and gobbling up the dead cells in a very efficient manner and putting the whole situation to rest. But in some women, for reasons that we're not totally sure, but we think may have to do with malfunction of the progesterone receptors due to exposures when you're a fetus, when you, the person who's experiencing the pain, is a fetus inside your mom's uterus, and you were exposed to chemical endocrine disruptors, these toxic chemicals that are just ubiquitous everywhere.
Right.
And the one that's gotten the most research is dioxin, which is a type of a pesticide.
Mm.
Um, and a lot of things that are involved in toxicities actually, sad to say, concentrate in the fetus. So the amount in the mother's blood is much less than the amount that ends up in the fetal blood. It's like crazy, and so it can dysregulate the receptors during the time of fetal life when the endocrine system, where you have all the different hormonal aspects of this like amazing system we call the endocrine system, all the different hormone receptors are forming and so on, that they do not create, they're not created properly to properly function. So because it's the progesterone that's elevated in the luteal phase of the menstrual cycle that is supposed to program the immune cells to not go crazy when the retrograde menstruation occurs, and then to properly gobble up these cells and such that come out through the fallopian tube. Another theory is that during the developmental time, some of these uterine lining cells may actually implant before you're even born inside your pelvis. And then what happens is when you have your period, they will also bleed, only they create all kinds of havoc and problems because you're having like bleeding and dead cells inside your pelvis that are like, oof, putting the immune system on fire. And that's why sometimes these conditions that we think usually occur in women starting more in their 20s actually can start in the early teens. It may be that these cells are already there by the time you're born. And then when you have your hormones blossom and wake up and you start having cycles, they wake up too, only they're in the wrong place doing the wrong thing. So you always have to think about endometriosis. And then you should always get a pelvic ultrasound because you never know if someone has a septum or like they have a double uterus where one side can't exit. And this has happened. And then you get bleeding that accumulates inside the uterus, like on one side, like if you have a double uterus or you have a septum. There's all these anomalies that they're not common, but they do happen. I've seen them all. And sometimes you could have bleeding into like one side of a uterus that's doubled and it has no exit. So it's blocked off. So all the blood accumulates. We call that a hematometra, where you get, and then of course that creates all kinds of pain. So you do need to get ultrasounds. It's very uncommon in teens to have uterine fibroids, but things can happen. So especially if you're a little bit older teen, like not say like 13, but maybe 17. But, things can happen. Anomalies can develop or be, you're born with and create different structural problems that can create pain as well. So you definitely, and then there are occasional women, I've seen everything because I've been around a long time, where the hymen is almost completely closed. And so a lot of the blood backs up. It just can't get out through that little bitty opening. And all that needs to happen to reduce all this pelvic pain and cramping that's occurring is to just fillet open the hymen and let the blood come out in a nice, easy way instead of having to trickle through this minuscule little hole. So there's a variety of things that can be anatomical as well. So a girl needs to be examined. Nothing should be assumed. The worst thing, in my opinion, is to just put them on birth control pills without even doing an evaluation.
Right.
And this happens all the time. It's like, oh, you're just one of the typicals, you have cramps. And most likely, the medical probability is that there's not an anomaly. But if you never think of these things, if you never consider any of these other things I mentioned, you will 100% of the time miss them. And 100% of the time, it's not nothing, structural. Sometimes it is. So, every girl that has these problems does need to have a proper workup. Now, what if you go through that workup and nothing is found? So then you're left with it's functional. So getting back to sort of my analogy with irritable bowel syndrome, there really are similarities in that what causes dysfunction of muscular contractions in the body? It's really a dysregulation of the autonomic nervous system. So, what is the autonomic nervous system? It's the neurological system of the body that controls everything we never think about. Like, we don't think about like our bowel having, our stomach emptying, our small intestine doing peristalsis. We don't think about making tears, making saliva, sweating. We don't say sweat on, sweat off. We think about heart beat faster, arteries constrict, arteries relax. We don't think about immune system activate into a pro-inflammatory state, go back to an anti-inflammatory state. We don't, thank goodness, we don't have to think about any of these things. And that's the vast majority of functions in our body. So this is what goes awry. And then we can talk about, like, once again, it's like in functional medicine, root cause, like it's like peeling the onion. Okay, so why do you have this? Like, okay, you have autonomic dysregulation. And so what happens is when you have everything right, you have proper bowel motility, and the uterus is a muscle, like we just said. And what is having a period anyway? What are you doing? What are you trying to accomplish? Well, everything in the female body, whether we want to have a baby, don't want to have a baby, I'm all for timing having babies when and if you want them, but we need to recognize the female body has evolved for the purpose of successful reproduction. In fact, that's the prime directive of life, is the creation of new life, and only humans are the species of creature on earth that tries to control our reproductive destiny. There's no other animal or anything, plant, animal, that says, I don't want to reproduce this year, or I never want to reproduce. That doesn't happen. You can't have a dog, because we were listening to your little dog before. You can't have a dog who's born and then says, you know what, I don't think I want to have, like any litters. I'm a girl dog, that doesn't work. They don't decide, they just do, So, but only humans, have decision-making capabilities, which I'm all for. But the bottom line is, it's really critical if you're going to try to address physical medical issues to understand the female body evolved for reproductive success. So to that end, we want to have normal menstrual cycles. So a menstrual cycle is about preparing the uterus for implantation of an embryo and ovulating an egg out of the ovary to then hopefully, if you're trying to get pregnant, meet up with a sperm and successfully go through this amazing process called fertilization. And then it develops and it goes down the tube at just the right rate, enters into the uterine cavity at just the right time, and then implants into the uterine wall through the lining, the endometrium. Well, when pregnancy does not occur, what then happens? Well, the uterine lining during the menstrual cycle is supposed to grow during the first half, which is called the proliferative phase, when you look at it from the point of view of the uterine lining, okay? So it's proliferating. And what causes it to proliferate? It's estradiol, the estrogen made by the ovaries. So you have growth, which we call proliferation of the lining. Then this miracle happens. It's to me like a miracle. And you have an ovulation, an egg is matured in the ovary, and then the special one is selected and it ovulates. And then, if you don't get it fertilized, then it just dissolves and it disappears. But what happens when you are waiting to see if you're going to be getting pregnant or not is that you make progesterone. So progesterone is made from a special structure called the corpus luteum of the ovary. And the progesterone has both synergistic and opposite antagonistic effects to estrogen. So in terms of the uterine lining, progesterone down regulates, it kind of subdues the function of the estrogen receptor and it stops the growth. So it's like the brakes. No more growing the uterine lining. It doesn't get bigger. But what it does is it like flourishes. It turns into secretory state. So it like blossoms and it fills out. It's kind of like a teen boy, right? He grows like a weed and he's really thin and then he stops growing and then suddenly he gets all these muscles and he, fills out and he gets a six pack. So that's kind of your uterine lining. It's growing, then it stops growing, then it blossoms. That's why they call it secretory. It becomes full of these like glands that make mucus and it's like a lush rainforest inside the uterine lining. And then when you are not pregnant, what are you going to do? You got to get rid of all this stuff that's just grown. This whole lush lining has to be eliminated so you can start over, like reboot. Let's try again to see if we can get pregnant the next cycle, because that's what nature wants, that you should get pregnant. You remember, we're the only ones that don't always want to get pregnant. So you got to get rid of all that lush lining. Well, how's that going to happen? It's like, what the heck? What are you going to get? How are you going to get rid of it? Well, the production of progesterone and estradiol plummets. Poof. So the support to that lining is gone. So now it's going to not have the blood supply, the hormone support, and it literally will die. Okay. And what do you do? How do you get rid of it? Because it could just sit there. It's like, like dead tissue, like sitting inside of you. So we have these mechanisms to get rid of that lining, to start fresh. And part of that mechanism means that you have uterine contractions. So think of having a period like a mini version of labor. And that's like really true, because what triggers labor so that you're going to have a baby? And can you have a baby without having uterine contractions? Yeah, you have a C-section, but that's not where we're going here. Like, we're talking about the way nature intended it. So you cannot just have a baby, deliver a baby, without going into labor and having coordinated uterine contractions, which nowadays is often not working right. Women have so many C-sections because their uterine muscle is not properly doing the contractions to have, and we actually have a name for that, because I did deliveries for like 25 years, thousands of babies all over Orange County. So you have to have a proper coordinated contraction of that uterine muscle. And when you don't, we actually have a name. We say dysfunctional labor. That's what we call it. Women have pain. Oh my gosh, in labor, women will have terrible cramps, labor pains. And guess what happens? Nothing. The cervix doesn't dilate. It's like, oh, okay, let's check you in another hour. Up, no dilation. Oh, finally, after 6 hours, it went from 4 to 5, and then then nothing happens. So we call that dysfunctional labor. You have plenty of pain. If you measure, there's a lot of contractions, but they're not doing the job. They're not coordinated in a good way to actually dilate the cervix and push the baby down and out. Well, the same mechanisms are actually in play. So what happens when you go into labor is you make pro-inflammatory prostaglandins. These are special signaling agents that are derived from omega-6. Okay? Now, they're the pro-inflammatory versions of these prostaglandins. There are also anti-inflammatory prostaglandins. Everything in the body is the yin yang, right? We have pro and con and everything. So you make, and then what happens? Okay, so when you go into labor, guess what also happens? Your progesterone production plummets. Okay, That's the whole way it works. So they're similars, okay? See, once you understand how the body works, you can see how pathways and enzyme systems and hormone system, they're kind of replicated in different parts of the body and doing different but similar things. Well, when you have a period, it's a similar thing. You have the dropping of the hormones, and you have increase in production of pro-inflammatory prostaglandins. Now, when people take NSAIDs to try to treat menstrual pain, like we'll say ibuprofen, right? That's really common, or naproxen, that's really common. What do they do anyway? And how can you take them? And I'm not in love with these drugs like for chronic use, but if you took them 1 or 2 days a month, that's not the worst thing on the planet that you could do to reduce pain. But what do they do? What's their mechanism of action? If you take them early on, they reduce the production of pro-inflammatory prostaglandins.
Mhm.
That's their mechanism. That's why if you use those for menstrual cramps, you need to take them preferably starting an hour before the pain starts, right? They're more proactive. Don't take them when you already have terrible pain. They're going to do next to nothing. You got to take them before, you got to be proactive, preemptory. So you got to take them starting a few hours before you expect the pain to start, if possible, to reduce the production of the pro-inflammatory prostaglandins. So now in a normal menstrual cycle, no pregnancy happened. You got to get rid of that plush lining so you can redo and start over with a new cycle. So the hormones drop, you start making lots and lots of these pro-inflammatory prostaglandins in the uterine cavity. Okay. And they are going to cause you to have a mini version of labor. Your uterus, the muscle, will contract. That is supposed to happen because that's how you get that dead, dying lining out. You can't just wait there. It's like, I hope it comes out someday. No. The body is actually trying to get it out. Now, one of the things that helps it to get out the best as well is if that lining is what we call complete secretory transformation state. So what does that mean? It means that you had enough progesterone. You had enough progesterone in the luteal phase, the second half after ovulation phase of the menstrual cycle, that converted that whole lining into the proper secretory state, that beautiful lush lining. But what if you don't make enough progesterone? We can say, like, why would a woman not make enough progesterone? We'll cover that in a sec. But say you don't, and that lining is not complete secretory transformation. And it's like somewhat, it's not the greatest, but it's somewhat. Well, it's going to be harder to get it out because nature intended that the uterine lining for, like, in this right at it before the period, and in the second part of the luteal phase should be in a state of complete secretory transformation for the purpose of one of two things. One, the perfect environment for implantation of an embryo. Two, no pregnancy is happening, the perfect endometrial lining to get rid of it, to exit in a proper way. So in order to have a perfect period without horrible pain, without prolonged bleeding and heavy bleeding, you need to have complete, perfect secretory transformation of that uterine lining. It needs to be just right for exit strategy or just right for pregnancy strategy. So a lot of girls are not having proper production of progesterone. So they don't have adequate complete transformation. And then because they're in a naturally, unfortunately, more pro-inflammatory state, okay? So like they're not eating the perfect diet and they're more like geared towards pro-inflammation. So they go over the top with inflammation. Inflammation is pain. You can't have pain without inflammation. So you have a few problems going on in these girls who have these terrible menstrual cramps. They are often not making enough progesterone. Now, in order to make enough progesterone, you need to have, of course, the right ability to make the hormones, but you have to be not in a constant inflammatory state. Okay.